Hi, I'm Dr. Angeli Akey.
And I'm Dr. Kathleen O'Neil-Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello everyone, happy Thursday and welcome back to the FIRRIMup Doctors webinar. My name is Audrey and today we'll be diving into our third episode of our COVID series. It's Post Exposure Prophylaxis, and that's basically just a long word for what to do after you've been exposed to someone with COVID. A lot of interesting information today, very useful stuff. So grab your tea, dial in, and I'll pass it on to our wonderful FIRRIMup doctors, Dr. Angeli Akey and Dr. Kathleen O'Neil-Smith.
Hi, everybody. Hi, Dr. Kathleen.
Hey, how's everybody doing? Happy February.
Yeah, happy February. Thank you, Audrey, for that introduction. Yeah, so we're in part 3 of 5 of a COVID series that really is designed to be user-friendly and something you could do to take action, be proactive instead of reactive, like has been our motto throughout the entire year of webinars. So today we're going to talk about post-exposure prophylaxis, what to do if you were accidentally exposed. Next slide. So, from kick COVID-19 to the curb, we talked about mobilizing your immune system army. So we're going to talk about some ideas, concepts, and strategies. But look at this cartoon. The reference is down there. So last week, we talked about the basics of prevention or pre-exposure prophylaxis all the way to the left. And today, we're going to talk about that cartoon where you see the coronavirus exposing that gentleman. What to do to treat shortly after exposure to minimize infection. And next week, we'll talk about disease management. So that's where we're at today.
Yeah, I mean, think about that. If only we could see the virus that easily, right? And we know that we do this for the flu. We know that we try to, if we think we've been around someone with the flu, people might take echinacea, they might take more vitamin C. There's all kinds of little goodies that are over the counter at the pharmacy. And we've learned a lot about COVID. And so it'd be really good. And people now are more, we've always treated the immune system in our practices, but people are now more aware of the immune system, including conventional doctors. So everybody's talking about what to do. And obviously people are looking at vitamin D now, yada, yada. So let's talk about post-exposure.
But I think I'd like to pause and just look at these viral particles in the cartoon and talk about the concept of viral load. Because in our last study group with the MD PhDs and MD PhDs, we talked about even in animal models that depending on the load of the virus that the animal models got will depend on the severity of their infection and their disease course. So I think now would be a time to talk about the effect of viral load and disease and illness.
Well, a great example of that is HIV, right? So we understand that you can have an exposure to HIV. This has been going on for 40 years, and it depends on the load of the exposure. And that's how we measure to track how sick somebody may get, how sick somebody is, and whether or not the treatment is working. So viral load with any bug is really important, because if you only have a small viral load, then it's very unlikely, unless you have a very poor immune system. We've talked about this in lectures a long time ago, back in April, then your immune system should be able to take care of it. But if you're not well and you haven't done prophylaxis pre-exposure and you don't take care of your immune system, a small viral load can take you out. But if you, including stress as something prior to being exposed, if you've been enormously stressed, not sleeping, I had a patient today who is so stressed, young guy. And I'm like, this is not healthy. You've got to, get a handle on this. But stress alone will make your immune system immunodeficient relatively. So being exposed to any little bit of virus will make you more susceptible to becoming sick and make it less likely that you're going to have a short course of that infection. So always strengthening your immune system, whether you want to prevent infection, autoimmunity, inflammation, or cancer. Immune system is at the base of all of those problems. So you've got to address it one way or another, because those are all the diseases we have.
But the concept I was trying to explain was that you have a certain amount of strength of your castle, your body, but the exposure to the virus, for example, there's a big difference between the viral load exposure from having played basketball outside with someone as opposed to sitting in the car with them for 2 hours driving from Gainesville to Tampa. That would be a more dense viral load. And even in the animal models, if you send an inhalant of a virus into a rat, and it's a higher dose than a lower dose, that rat's going to get sicker with the higher dose. So that's why it's so important to do physical distancing, make sure that you have good fresh air and minimize the aerosolization.
Yeah,
next slide.
Is really important. The other point that I was thinking just now on that is, what was I thinking? I don't know, but it will come back to me in terms of exposure. We'll keep going and we'll come back to me.
Okay, so why post-exposure prophylaxis? Okay, I think you too, Dr. Kathleen, have been so busy with all these calls, especially after the holidays, for accidental exposure. That was a true situation. I mean, those examples I said was playing basketball outside with someone versus driving a car, not knowing that person would turn COVID positive the next day. So here's the first question. Why should I take action steps after I have already been exposed?
Well, you don't have to, but if you do, then it is more likely, not guaranteed, but more likely that you can reduce the risk and severity of the illness. Oh, I know what I was going to say. If you've been taking pre-exposure or immune support, immune fortification, one of the things that's really important about the immune support and the fortification and then post-exposure prophylaxis is that the mechanisms by which many of these nutrients, supplements, and even medications work is to prevent the virus from getting in, even if you have a large exposure. So there are mechanisms by which vitamin C activates natural killer cells. And if you have good vitamin C levels, you're going to boom. You're going to, just like these little army guys here, you're going to take care of that virus before it can attach to the ACE receptor or any other receptor. If you have if you have zinc that's getting into the cells, if this happens to get through into your cell, boom, zinc is there to potentially affect that. So that's why taking post-exposure can minimize the risk of becoming very sick. And that's really important. I know for me, I took pre-exposure and post-exposure prophylaxis, and it really, really helped me prior to getting COVID. I did still get COVID, but it was really not a big deal.
Yes, that was miraculous. So, and I think we're actually doing a retrospective chart review of both of our practices because the people we thought would get sick, like the classic obese 63-year-old man who has diabetes and hypertension and has had many strokes in my practice, sailed through his COVID illness. And he had come into it with pre-exposure prevention protocols. Then when he got exposed and then sick, we upped everything and he did quite well. He was anxious to go back to work within 2 weeks, never really desaturated. So yeah. When is the best time to start? As soon as possible after exposure. What should I do after I've been exposed? We would refer you to the iMask Plus protocol. I know that many of you have read our guidebook, Kick COVID-19 to the Curb, where we laud Dr. Paul Merrick of Eastern Virginia Medical School. He put a consortium together of frontline COVID doctors, intensivists, and that website is flccc.net. But we'll be spending a lot more time on the iMask Plus protocol next week, but we are using it in our practices.
I just want to point out there, because I've had this conversation with a bunch of patients, that there are several protocols online. There are some who are conventionally hospital-based. There are some who are, private groups. Medicine is an art, and it's really important that we think about many factors when we recommend a particular protocol for post-exposure prophylaxis. Mostly, is it going to be safe for everybody? Because we're going to do that across the board. And I think that for the type of work that Dr. Akey and I do, we also think outside of just a prescription medicine. So there are other things that are perfectly safe, 100% safe. There's no upper limit of normal that we might also recommend in our post-exposure prophylaxis. So don't be confused if you see a variety. Find your source, find the person, your go-to person, and use them to help you understand which particular protocol you would like to use, what feels best to you, and understand why. But we've talked about most of them, the differences in our book.
Yes, to your point, COVID illness manifests in different ways in different people, and you need a trained clinician to understand, okay, if this, then that. And then also, we tend to understand our patient's biology at baseline really well. So we know where your weaknesses are in your castle. So we will recommend nuanced fortification in those weaknesses. For example, if you have a clotting disorder, then we would prevent that. I mean, we would give you high-dose fish oils, aspirin, and or potentially anticoagulants coming into it, or should you have been exposed?
Absolutely. Very true. So how is post-exposure prophylaxis, trying to prevent getting very sick, different from prevention or illness management? Well, we saw that chart way back when. Audrey, could you go back to that again? I mean, you can see where it is in the, in the timeline. This is prophylaxis on the far left. Treatment is if you've got a fever and you are sick. So I really think that and you're exposed, obviously, but it's really important to understand that just because you have a positive test, it doesn't mean that you will get infected. Infection is when the positive test occurs with symptoms of the disease, symptoms of infection, and symptoms of infection, which we know for COVID have to do with fever, sweats, breathing issues, smell issues, GI issues, muscle pain issues, any combination of those. So that would be treatment. Then it's termed treatment. Thanks, Audrey.
And they really haven't done a great job. We haven't really done a great job segregating COVID positive testing versus illness, COVID illness. And so when you look at case rates, you don't know what percent are just positive and not sick, or what percent are sick. And those are two different things.
Yeah, and the other thing is you may not even know that you were exposed. You may feel sick. It could be COVID, because who knows how this bug spreads? I mean, there's all kinds of crazy stories about it. So if it looks and smells, we've talked about this before, and acts like COVID, we believe it's COVID. I had a patient today, just before this call, this webinar, who I know very well. She's a dear friend, and she texted and she said, I think I have COVID. Can you help me? Can you help me? And she described her symptoms, which were nausea, dizziness, inability to turn her head, and no fever, no other symptoms. It's not COVID. So she's brilliant. I said, look up vertigo. And she texted me back and said, that's what it is. You don't have to take care of me quickly. So she was really worried that it was COVID, and she wanted to receive treatment as soon as possible. But I don't really think it's COVID. We'll test her later today.
You are a great clinician.
Mm-hmm.
Okay, so let's look at this picture one more time to the right, where you have the virus particles and you have the army. When we're talking post-exposure prophylaxis and we go through our recommended protocols with you all, you'll notice that last week we talked about prevention, which primarily is a C-DAWS plus, vitamin C, D, omega-3, zinc, that's a C-DAWS, plus a quercetin, plus silver to your nose, right? So it's a very simple formula that we would triple the C-DAWS should you have exposure, and continue the rest of the supplementation, which we'll review in just a minute. But that makes sense, because basically, if there's worry for higher numbers of viruses in your environment, you want to call to arms your army. And that's what we're doing, is we're fortifying them with, for example, guns and being better able to fight, because there's a higher likelihood that the invader's coming. Next slide.
And the book gives more examples of that. I mean, the book will tell you exactly what each of those are going to do for you. So that's really, it's easy. It's an easy reference. Look at this. I love this. Mythbusters. Go ahead, Dr. Akey.
Yeah, so myth number one, there's a 100% chance I'll get COVID if I'm exposed to someone who's tested positive. Well, we told you way back when with the Wuhan, China studies that even within a household, the transmission between couples was only like 27%, and just people within the household about 17%. So we knew way back in March that that was not true. And again, it depends on not only your dose of exposure, but what your immune system is. What is your castle like? Is it in disrepair? Are you too stressed? Are you not sleeping? Are you obese and inflamed? Well, your castle's at risk.
I should stop my supplements if I'm exposed or get sick because it's too late. Well, clearly we know that that's not true. So, I mean, I think that's just a silly one because we should continue them. And in fact, we think if you're exposed or get sick, you need more of the supplementation in order to help you.
If someone has a vaccine, I don't have to worry about getting exposed. All right, so with the Pfizer and the Moderna vaccines, which are the mRNA vaccines, and those of you who are on the call now, I have a group medical visit at 4:30 on this. We know that you still have to be careful because even if you, after 5 weeks after the first Pfizer vaccine and 6 weeks after the Moderna vaccine are 94.5 protected against the disease state of COVID, you could still transmit.
You will fight it if you're infected, if you have the vaccine. That's what we're hoping for. That means the vaccine is efficacious, but you can still transmit it through your nasal passages. Post-exposure protocols will give me total protection from getting sick. No, 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 no. Nothing gives you total protection. The way that you can best protect is use the protocols, use masks, stay distanced, etc. But there are other factors like, you know, the receptors for renin-angiotensin, for RAS, we don't know anybody's receptor number. There's no way to determine that. So someone who has some genetic anomaly or some genetic mutation or some higher number of RAS receptors, they may need a smaller viral load to get infected. We don't know these things. It's the same thing with any other viral infection like HIV or influenza. Some people are more prone to them for reasons that we don't understand. But for the reasons that we do understand, that have been written about up to date here and now, we recommend this PEP protocol to help keep you from getting sick and needing to be hospitalized.
Okay, here are some facts. Fortifying my immune system after exposure can significantly decrease my chances of getting COVID illness. That is true fact, especially, you know, there's a lot of data now, for example, on vitamin D. We are doing, in terms of combining things and studying them and quantifying our outpatient management, it's actually in the works. I know that, for example, the NIH actually tried to sponsor a study of hydroxychloroquine and azithromycin back in October, but no one enrolled. So they dropped that whole outpatient study, but we're now collecting data. Even in our own practices, we're doing a retrospective chart review to show that this type of management does decrease illness.
Help me. It helped me. And I'm not young. I recognize those little army guys on the prior slide and brought me right back to childhood. The duration and nature of exposure affects the probability that I will get COVID. That's what we've been talking about. So that's true, as we know.
Post-exposure protocols can lessen the severity of my symptoms if the virus is transmitted. Yes.
Supplements are very beneficial in fortifying my immune system. All of these facts we've been trying to really, you know, reiterate over and over again so that it's crystal clear.
So is sleep and eating well and being happy, increasing oxytocin, that bonding hormone despite the pandemic, and decreasing cortisol or too much stress hormone. Those will really help fortify your immune system. I watched an Instagram from one of my scientific heroes, Dr. Jeff Bland, PhD, and he's 75, and he actually got a Moderna vaccine. I think it was Moderna. It was one of the mRNA vaccines. And he said that he too has an Aura ring which actually the first 48 hours after his first vaccine, you see his readiness score goes down. Really great readiness score is about 100. He usually lives in the high 80s to low 90s. You could see his go down to the 50s for then 60. Then in day 3, he was normal. But if you're interested in biometrics, this is a great study. My team actually got me an Oura ring for Christmas, Dr. Kathleen, and I've been watching my Oura ring. But now with Dr. Bland saying that and Instagramming that out, I'm going to be watching my Oura ring to see what my body's doing, because he said he felt fine, but he could see his readiness score went down, which he believes is correlating with his immune system being activated.
It's true. He is, this gentleman, this doctor is amazing. He's one of my heroes of all time. Brilliant, brilliant man. And I'm sure he's continuing on his supplements, even though he got a vaccine, because he understands and teaches about those. And we all should, because it's not like the vaccine's gonna change your immune system. You really want to even make your vaccine more efficacious by continuing your supplements post getting the vaccine. An Oura ring, O-U-R-A is how it's spelled, O-U-R-A. I have one as well. And there's lots of things like Whoop, Oura ring, lots of different variables that you can track and follow either on your iPhone or these rings. They're amazing. And it's really not about 1 day or 2 days. It's really about the big picture. You get to see your patterns. And so it's really great to see patterns, which is what Dr. Bland demonstrated. And then those patterns, we can put them together with blood markers, urine markers, all kinds of other things. It's really helpful to have as many markers, as much data as we can possibly have. Next slide. Here is the immune post-exposure prophylaxis. And we've looked at this to make sure that it was cost effective and sustainable for people. So one of the things that we had our team do was find the best and most affordable source of each of these particular supplements. And you can get everything on here, aside from the Neo 40 on the bottom right, for $5. And that's really, for $5 per day to take all of this. That's pretty phenomenal. We talked about that last week. If you are exposed and you want to up your prophylaxis and have better exposure, a better immune system response, you can double or triple this. We suggest tripling it if you know you've been exposed, at least for the time frame of 10 days or 2 weeks, and then you could go back to the regular dose. So tripling it will put you at $15 a day for a week, 7 or 10 days, or whatever your doctor thinks the time frame should be, but we think that's very reasonable. CDAWs up top. You want to review that, Angeli?
Yeah. So basically, we talk about our CDAWs protocol, which every American should have been shipped this right off the bat. Vitamin C as in cat. And anywhere between, as long as your tummy tolerates it, 2,000 to 4,000 milligrams. D3, most of our patients, we know the levels. But if you're acutely exposed, increase it to 5,000. It's not going to hurt you short term. Omega-3 fatty acids, we spent whole webinars on this already. If you could tolerate 4,000 milligrams, great. Zinc, if you've been exposed, 50, 75, even 100 milligrams, depending on if you GI tolerate it. Your baseline in my practice is around 25 to 30 milligrams baseline. So what we were saying was triple it if you were having an exposure, but only do it short term, because you could change the zinc copper ratio at that high dose. Short term meaning 7 to 10 days. And remember, from Kick COVID-19 to the CURB guidebook, you need your 3 basic instruments. I was telehealthing people today who had exposure, and despite messaging this since last March, people did not have a pulse oximeter, and they're now readily available on Amazon. So the 3 basic instruments are a thermometer, a blood pressure cuff, and a pulse oximeter. Okay, so the CDAWs is up top, and then the plus is down here. Quercetin. You want to talk about quercetin, Dr. Kathleen?
Oh, I love quercetin. So we have a really big issue presently in our environment with histamine responses. And what happens is when the immune system gets activated and upregulated, basically as those little army guys are shooting their arrows or whatever they're shooting, tear gas, whatever it is, there's just a big mess. And what quercetin does is stabilize all of the debris from the arrow, the shooting, the tear gas, whatever it is, and basically holds it in a granule, holds it in a container within the mast cell. And so we can really stabilize these mast cells so that we don't get a cytokine storm. So everything just doesn't keep growing and growing and spiraling out of control. Quercetin is just fantastic.
We've been using it for a lot
yeah.
of time for allergies as well. So if you have allergies, quercetin's a go-to anyway.
Mm-hmm. Silver is great. We use silver when we have any infection, or we've, cut open our knee or we've cut open our anything. And so we use it. Quercetin can be used in kids with allergies. Yes. Silver, if you were to go to the emergency room because you were going to get your knee stitched up, they would put silver on the wound before they stitched it up. So silver is antimicrobial. So it is a really, really good thing to use. You can take it as a nose spray. You can take it in water. There's all kinds of types of it. There are gels, there's liquids that have no taste. Silver is wonderful. An immuno-PRP spray is really, really good because that basically is more like a colostrum. Again, colostrum being improving our immune system, and we can use that in the nose. We can use that in water. It's just easy peasy. And Neo 40 is for endothelial function, because we know that COVID is an endothelial disease, blood vessel disease, and that the blood vessels if we don't take all of those other things on the left and above, then basically, and we've got this immune cytokine storm and this activation of our immune system, the inside of the blood vessels become inflamed, and then the blood vessels get leaky. And Neo 40 helps to keep the blood vessels, keep the blood flowing, keep everything healthy within the blood vessels. It's very, very important. And we had a great lecture on this at FIRRIMup back in July or August that you could go back to with Nathan Bryan.
Yeah, I can hardly believe it. Dr. Nathan Bryan, who founded Neo 40 as a company, he studied under the man who got the Nobel Prize for nitric oxide, and he was on with us actually in August. It's been a long time already, but we'd refer you to that at our FIRRIMupDoctors.com. Just hit our YouTube channel and you can find it. Okay, we'll move briefly through this. So in Alachua County, we've had 21,000 confirmed, 176 deaths. We've managed close to over 100 now at this point. 2 deaths. One was an 87-year-old woman who had chronic lung disease who died in the hospital. The other was a 90-year-old woman who had COVID, went to the hospital, then got discharged home, and then she had a death. But overall, we're doing really well. And like I said, we're doing a retrospective chart review because our patients who were supposed to be sick, were not, and they're managed outpatient. So I'm really happy for our combined efforts.
Massachusetts is a whole different ballgame because it's winter here and snowing and everybody's indoors, and the restaurants are closed. No one's going to restaurants. No one's going out. And really everyone's pretty much homebound. So, and we haven't been doing a great job with vaccines. I'm not sure what's going on with that, but we're pretty stable. I mean, I think we have a much smaller community or group of residents here in the state, and we've had 1,500 deaths to date. I know that the hospitals have some capacity, so that's good. Hospitalizations are going down. I think deaths are still steady right now, and we think that was all related to the holidays. So here we're not really growing by leaps and bounds because it's winter and most people really aren't going out. You can't even have more than I don't know, not very many people in a restaurant. It's mostly takeout here.
Next slide. So when we talk about the vaccines, 1.8 million doses in Florida, 500,000 in Massachusetts, about 1.7 and 1.8% of our population fully vaccinated. I had a disturbing call today from someone in outside county, Northeast Florida, who got the Pfizer vaccine #1, and they refused to schedule her for vaccine #2. So she's now in the lottery and what to do. And yeah, it's becoming more common, unfortunately. Do you have any thoughts behind that, Doctor? Kathleen, like I said, we'll get in the lottery, and I don't know how to make a Pfizer vaccine magically appear if they won't.
No. It's
schedule
really
a second.
complicated. I mean, the states can't even figure it out. So I'm sure we can, and we're pretty creative. So especially, if somebody's requesting something from us, we like to please. But I don't. It's really crazy. I mean, I don't
I
know.
did tell her that. Oh, I'm sorry. Go ahead.
I still believe that what we're teaching on here, I believe with my heart and my soul that immune fortification, post-exposure prophylaxis, and the protocol that we have that you can be prepared with, speaking to your PCP with the medications, I think those are great mechanisms for people who are low risk, medium risk, and high risk. So if we can get high risk people, that help them get vaccinated, I would, but I do think that the treatment protocols that we have available to us are excellent. Excellent.
I totally agree. And I wanted to reassure her that we're just a email hotline away should she have any exposure, but she's quarantined in, and that she already got 50.2% protection after the first dose of Pfizer vaccine, according to the phase 3 trial. So it's not for naught. And we're just trying to do the best we can with the tough situation. Okay, next slide. Just a heads up, if you guys are curious about vaccine reporting, there's been over 25 million doses given out, but yet only 1,065 adverse reactions reported. We spend time looking through that periodically, and there's been a couple of deaths. There's a couple of autoimmune type things, but really I think we're terribly underreporting. I don't think it's that helpful at this point because I think we're underreporting.
It's not helpful. There's no context for it.
Right.
And I think we're underreporting.
We're going to invite our patients to make an individual telehealth consult so we can discuss these in regards to your own personal and social situation. We know your bodies pretty well. Those of you who don't belong to Dr. Kathleen's practice in Boston or my practice in Gainesville, North Central Florida, we'd invite you to email FIRRIMupDoctors@gmail.com. We are doing telehealth consults at our FIRRIMup practice as well in regards to COVID prophylaxis, etc. We'd invite you to join us next week, a week for COVID illness management, when your castle is under attack, if you've read our guidebook. Next week, we will be spending more time on the data regarding our protocols, as well as the iMask Plus protocol that includes the World Review on ivermectin. If you want a preview of that, you could look at the Frontline COVID Workers Consortium. The website is flccc.net. That's flccc.net. And good news, FDA has moved ivermectin to neutral. No longer is it against, it went to neutral. The same with South Africa. It was against and now it's neutral. So it's heading in the right direction, just to give you a little heads up on that. And we'll spend a lot more time on looking at the data with a couple of slides next week in COVID illness management.
Yeah, I'm looking forward to that.
Okay. Yeah. According to the Gainesville Sun today, they're planning to vaccinate 2,000 people at UF Stadium on Friday. It's the health department. I just can't see how they can make it safe for such a huge crowd to gather in one place. If I choose to go, are there any other options for me to go where to get a vaccine? I did read about that also in the Gainesville Sun, because that's how things go moving so fast. You have to look at it in the paper. UF Health is actually in charge of that effort. They're just used in conjunction with the health department, but it's mostly under UF Health, and they've been very cautious with physical distancing. It's going to be inside in the touchdown terrace, so it's not even outside. If you go, make sure you wear a mask. And if you just have a soft cloth mask, wear 2 of them. Wear eye protection, please. And one other thing I've noticed, just a by the way, remember that if they vaccinate the left arm, for the second vaccine, have them vaccinate the right arm. There's been a couple of complications that I've seen in my patient population where they did a double on the left arm because it was drive-through, and it never healed after the first one. Then they got a second one in the same arm. And so I'm dealing with a lot of lymphadenitis and tenderness, et cetera. So it makes sense. You have 2 arms, 2 vaccines, use 1 arm in sequence. So I hope that helps.
Yeah.
And yeah, next slide. Okay, so please send in your questions. Anything that we didn't get to in the chat, we try to get through them as we were going along. We will address next week. We're going to be signing off now. So for now, everybody, thank you for joining us week after week. We're almost into year 2. And Dr. Kathleen, thank you for joining us in Boston.
It's
Audrey,
a
thank you
pleasure.
for hosting.
It's a
Be safe,
pleasure.
be well, and God bless you all. Thank you
Yeah,
very, very much.
looking forward to next week. Thank you all. Ciao.
Okay, everyone. I'm just going to quickly go over our supplement features and our book features for this week. I know both of the doctors talked extensively about the immune pack. This certain one basic immune pack was actually what was talked about last week during our prevention series. And both of these supplement packs you can actually get up on our store, the FIRRIMup Doctors Get Healthy store. So if you put that link in and you navigate to it, right at the top of your screen will be all the supplement bundles, and the blue ones will be the standard version, and the green with the little leaf will actually be the vegan vegetarian option. So all of these you can get right on the FIRRIMup Doctors Get Healthy store. And this basic immune pack, I know they went over it, but the top row is going to be the CDAWS protocol. So we have the neurobiologics vitamin C, 2 options for your D. The one on the left, D3 2000, is going to be the standard version, and then the one on the right, the liquid version, is for vegans, vegetarians. And then for our Omega, we have 2 options as well. We have the Pro Omega 2000 for the standard version, and then on the right, we have our Algae Omega for the vegan vegetarian. We also have the Pure Encapsulation Zinc 30, and then the Pure Encapsulations quercetin, and then also that colloidal silver spray that you can use nasally, and then the Neo 40 lozenges. So all of these you can get, if you just click on that bundle, you won't have to add them separately to your cart. It'll just go all in the same place. And then next we have our Post Exposure Prophylaxis bundle. So this one the doctors went over today, and this is actually the same foundation as the basic immune pack, but we're just adding that immune PRP spray. And then if you were to be exposed to someone with COVID, you would want to double or triple this protocol. So same exact supplements, and you can get them at the same place. And then if you wanted to get the vegan vegetarian option, it would be that green bundle with the little leaf. And then next we'll go into our books for this week. We're still promoting the Kick COVID-19 to the Curb guidebook. It's a perfect book to go along with this series. There's so much useful information in there. The doctors really reference a lot of the things throughout this webinar directly from that book. And we have our special going on where if you purchase the book, either the ebook version for $9.99 on Amazon Kindle, Google Play, or Barnes & Noble, or the paperback version for $29.99 on our website, or actually at our office, you can show us proof of receipt, so a screenshot or a picture of the paper receipt, and we'll offer 20% off of our supplement Ultra Potent Vitamin C, and then also the Zinc AG. And just to let you guys know, we do have the guidebook also on Audible. And if you're new to Audible, if you sign up, your first book is free. So definitely take advantage of that offer. You could get this book for free. And then next we have Dr. Akey's Fine Tune Your Hormone Symphony guidebook. So this is all about looking at your hormones, balancing those for your overall wellness. And you can get that book at our FIRRIMupDoctors.com website. Next, we have our Fascia Function and Medical Application textbook. So this book you can actually get curbside if you email nfimgmv@gmail.com. We'll offer curbside pickup at our NFIM office, and that will be for $55. And then this book is also available on our FIRRIMup Doctors website and Amazon as well. So that's all I have for you today. Thank you so much for tuning in. And next week, we'll be talking about COVID illness management. So what to do if you actually are experiencing COVID symptoms, you've tested positive for COVID. Definitely tune back in for that. It's going to be a great conversation. Bye, everyone. Be safe and be well.
We're so glad you joined us today. We hope we've given you the tools to take control of your health. For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM Doctors.com. And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.